The record base, trial denture base, is made on the stone definitive cast. It is made of light or autopolymerizing acrylic. When wax rims are added, it is used to establish the facial contour of the denture, as well as to accommodate the presence of the tongue. This position of equilibrium between the tongue, cheeks, and to the occlusion rim is known as the neutral zone. The occlusion rim is used to establish the patient's vertical dimension and to record the patient's MMR. Steps in making the rim include creating a posterior palatal seal, blocking out undercuts which would, if engaged, break the cast upon retrieval of the record base from the cast, placing separating medium to prevent the material from sticking to the cast, place and cure the material, remove from the cast, examine the base for sharp spots, and place a wax rim of anatomically average dimension. The record base should fit the cast without rocking. It should be ideally of uniform thickness, approximately 2 mm, and should have rounded borders and no sharp spots. The posterior palatal seal area is a critical area for retention of the maxillary denture. The processed denture will shrink and pull away from the cast. Since denture retention depends on adaptation to the cast and the mouth, an area is deepened on the cast to ensure that when the denture is placed in the mouth, the denture will be intimately adapted in this area. The area between line A and line B, seen in the diagram, is the posterior palatal seal area. Line A is the vibrating line. It runs from the hamular notch to hamular notch, 2 mm anterior to the fovea palatini. It can be identified in one of two ways, as follows. The clinical procedure for finding the vibrating line. First, the vibrating line may be estimated in the mouth. Find the vibrating line at the initial exam by asking the patient to say "ah." Alternatively, ask the patient to hold their nose as they blow out. Use a Thompson marker to draw a line. The line will be picked up in the impression and transferred to the cast. Alternatively, locate the fovea palatini on the cast. A line 2 mm anterior to the fovea palatini and into the hamular notch is a very accurate approximation to the vibrating line. Draw a line from the hamular notch 2 mm anterior to the fovea palatini. Draw a line B 2 mm anterior to line A. This outlines the posterior palatal seal area. Next, you will remove stone from the cast to create the posterior palatal seal. Cut a groove in the stone according to the above diagram. This will compensate for shrinkage of the palate that results from processing the denture. This acrylic maintains tissue contact when the denture moves in function. The shape is somewhat like a V or a U-shaped notch, keeping in mind that this will be rounded and smoothened. Some approximate dimensions are mentioned. It is important to note that excess acrylic may be removed after the denture is processed. It is better to slightly overdo it than to do too little. It extends through the hamular notch about 3 mm and is about 1.5 to 2 mm wide at the hamular notch. Some approximate dimensions are mentioned. It is important to note that excess acrylic may be removed after the denture is processed. This illustrates the basic shape of the posterior palatal seal. Once this has been established, you are ready to block out undercuts on the cast. Undercuts are interferences to the path of placement and withdrawal. They should be blocked out with wax. The area noted in red is undercut, relative to the path of placement noted by the line. Blockout wax is placed on potentially undercut areas. This makes the intimately adapted base simple to remove and prevents the cast from being fractured. Too much blockout could cause instability of the record base, but it is preferable to a broken cast. Apply a separating medium to the cast. You will use the sprinkle-on method to fabricate the record base. Acrylic powder and liquid are alternatively placed on the cast in increments. The record base should be approximately 2 mm of uniform thickness. Cover the wet acrylic with a rubber bowl and allow to cure for 1 hour. Remove the record base from the cast. Use acrylic burrs or the lathe to remove gross excess. The borders should be smooth and rounded. For the mandibular cast, you will use the light cured acrylic material triad to fabricate the record base. The procedure is basically the same. Undercuts are identified on the mandibular cast and blocked out with wax. To do this, sight down the cast with one eye closed. Once the blockout wax has been added, then apply separating medium. Adapt the material to the cast without over-thinning. Ensure that the material extends into the vestibule. Trim off the excess material with a laboratory knife. Cure the record base for 3 minutes on the cast. Carefully remove the record base from the cast. Coat with Vaseline on the outside and on the in-tissue side. Return the record base to the cast and cure for 4 more minutes. Once the acrylic is cured, trim excess acrylic flash with acrylic burrs. This slide demonstrates the correct adaptation of the record base borders to the cast, circled in red. This slide demonstrates correct adaptation of the record base to the cast. The completed rim is smooth, does not rock on the cast. It is sufficiently thick to resist breakage. It is only necessary to smoothen and polish the border areas. Do not waste time polishing the whole thing. Excessively thick bases will prevent easy adaptation of the teeth.